Hello, my name is Angela Davis, and today I am going to be doing a head to toe assessment. Can you tell me your name and date of birth?
I'm Scott Davis, August 8th, 1983.
And is it okay to do the head to toe assessment today?
Yes.
Great. So I would start before doing a physical assessment, and I would go through your medical history, surgical history, family history. I would ask about allergies, any medications. I'd go through your full social history. I'd ask about smoking, alcohol, drug use, if any current use, past use. I would ask about your employment for your social history. I would ask about any family history. Some may be pertinent or not, but I would ask about family history. Um, and then I would ask you if you were having any um, issues for social determinants of health. I would meaning like, do you have any problems with access to getting food, transportation? If you're on medications, are you able to afford them? Just making sure that I can get a complete picture of any barriers to your health that you might be experiencing. Following that, I would ask, is anything hurting you today? You know, so that I could make sure that when I'm doing my physical examination, that I could focus more specifically on areas that you may be complaining of issues. I would also ask about vaccination history and any psychiatric history included in the beginning part to get all the information, just so I can get the full picture. Next, I would make sure to perform proper hand hygiene, and I would move on to getting all your vital signs. I would get your blood pressure, heart rate, temperature, oxygen, height, weight, calculate your BMI, all those things. And I would also, while we were up and you getting your height and weight, I would test cranial nerve 2, which is your optic nerve, by asking you to read the Snellen eye chart. I would note that you're wearing glasses, so your vision would be corrected reading the Snellen eye chart. Next, I would move on to just noting your overall general appearance. I would note that you are well groomed, you appear in no distress. Hopefully, when I took your temperature, it would have been normal, so you would be afebrile. Since this would be my first time examining you, I wouldn't be able to note if you actually had any weight change, but I would ask you, I could say, have you been gaining weight or losing weight, just to get a gauge, and whether or not you've been actively trying to lose weight or not. So that could be part of your general appearance as well. I would note the color of your skin to make sure that you were a normal color, normal pink color. Just assessing all the areas to make sure you're not pale, or if you were oxygen deprived, if you were blue or dusky colored. So I would begin really by looking at the skin on your face, just check, making sure that it wasn't moist. Are you, is it dry? Is it moist? Is it pink? Kind of as I said before. I can see your arm. I can check the temperature of your skin, and then I can assess your capillary refill here while I'm here. I can check your skin turgor to make sure that checks for dehydration, and I would do the same on this side. I would check your skin temperature, it's warm and dry, and I would check the capillary refill in each fingertip. And then as we proceed through the physical examination, I would be continually checking your skin to make sure that I don't see any nevi, anything suspicious for melanoma. I would use the ABCDE to determine if it was suspicious. So I would make sure to note any areas of concern as we move through the exam.
Okay.
Next, I would move on to the head, ears, eyes, nose, and throat portion of the examination. I would start by inspecting your face and your head. Make sure that it was symmetrical, that there's no deformities. Just making sure everything's symmetrical. And I would then move on to palpating your head. I would be checking for any depressions, abnormalities. I would be checking your hair distribution and texture, and checking for any infestations. So I would just palpate your head. I would part your hair to make sure that I don't miss any moles or anything that could be concerning. Then I would observe your facial symmetry, making sure that we'll look at your expression and just checking the symmetry of your eyes. Then after looking at that, noting your, that your eyebrows are symmetric as well, I'm going to ask you to remove your glasses so that I can inspect your eyes. I'm just going to ask you to look straight ahead. You're going to feel my hands on your face. I'm going to pull down so that I can inspect your conjunctiva. I'm going to ask you to look up. Okay. You must be a little tired. I can see that your eyes are a little bit bloodshot there. So after I inspect your conjunctiva and sclera, I would take note of that, and then I'm going to move on to assessing your pupils, and I would do that using a pen light, and I'm going to turn the lights down. I'm just going to ask you to look straight ahead. Can you open your eyes? Okay, so that's a direct reaction, and then I'm going to check consensual reaction. I'm going to shine a light in one eye and then move it over to make sure that the other one is, because both pupils are supposed to contract. Okay, so open your eyes. So, and then the last thing I'm going to do is I'm going to ask you to look straight ahead, and I'm going to ask you to, you can see this, right? Mm-hmm. So I'm just going to ask you to follow this pen light as I move it in to touch your nose. Can we do that one more time? Okay, so that is just testing accommodation. So your pupils are equal and reactive to light and accommodation. Next, I'm going to use my ophthalmoscope to check the ocular fundi in each eye. I'm going to note the sharpness of the discs and check for papilledema. So I'm going to turn this on. I'm going to ask you to look straight ahead. I'm going to look in that eye. And then I'll move over. Sorry, I know that's bright. So following inspection, everything looks good. Just your eyes are a little bit bloodshot. That's about the only abnormal thing that I see. Otherwise, very good. Next, I'm going to move on to evaluation of your ears. I would start with inspection. So I would just look make sure that your ears were symmetrical, that there was no abnormalities. Then I would palpate each ear. I'm gonna just feel for nodules, and I would ask you if you had any tenderness. Are you having any tenderness?
No.
No, okay. And then I would check the other ear to make sure, same thing. And then I will grab my otoscope and I will look in each of your ears. So for an adult, I pull your ear up and back, and then I'm going to look at your tympanic membrane and your ear canal to make sure that that it's not red, there's no cerumen impaction. I'm going to look at the cone of light. I'm going to make sure that the tympanic membrane is pearly gray. All right, looks very good. And then I'm going to do the same over here. Very good. Next, I would move on to assessing your hearing. So I'm going to do what's called the whisper test. So I'm going to cover one ear. I'm going to whisper 2 words. I'm going to ask you to tell me what they are. And we'll do it on both sides.
All right.
All right.
Cat, dog. Cow, horse.
Very good. Then next, I will grab my tuning fork so that I can perform the Renee test to assess air versus bone conduction. You should hear the sound longer through air than bone. So I'm gonna strike my tuning fork, put it behind your ear, and I'm gonna ask you to tell me when you no longer can hear this.
Now.
And then can you still hear it?
Yeah.
Okay. So that is a normal result, and then I would repeat the same thing on the other side. So following the assessment of your ears, which is normal, I would move on to assessing your nose. I would, again, start with inspection. I would look to see if there's any obvious deformities, check for any abnormalities. And then I would want to assess the patency of your nose. So either I could do it or I could ask you to do it. But for these purposes, I'm going to cover one side. I'm going to ask you to breathe in and then out. And then I'm going to cover the other side. Okay, so your nose is patent. And then I would want to assess your sense of smell, which is your olfactory cranial nerve. And I would do this by having you close your eyes. I would cover one nostril. I would ask you to smell something. You would identify the scent. I would do it on the other side with a different scent. I would ask you to identify it. I would want to use familiar scents like cinnamon, coffee, those sorts of things.
Yeah.
I would not want to use a scent that smells terrible and elicit your gag reflex. So that is how I would assess that cranial nerve. Then next I would want to look inside your nose. So I'm just going to use the same light and I'm going to look. I'm just going to check for any redness, any exudate. I would look at your We just look to make sure you don't have a deviated septum. I'm gonna check on this side. The left side actually is a little bit red, so, but you have no drainage or anything like that. Do you have allergies?
Probably.
Yeah, so, so following your nose examination, I would want to palpate your sinuses for any tenderness. So I'm going to palpate, and you're just going to let me know if you have any tenderness.
No.
No. And then any tenderness there?
No.
Good. Then next I am going to move into assessing your mouth, your lips and your mouth and everything. I would want to just see if your mouth was, if your lips were cracked, noting the color, they're pink, looks good. I'm going to ask you to open your mouth. And then I'm going to just look inside. I'm just going to look at your teeth. And then can you stick out your tongue? And I would just want to note any cracking or anything in your tongue if it was dry, but as of right now, everything looks moist. I'm going to ask you to open your mouth again. And then I'm going to ask you to lift and then turn your tongue to the left and then turn to the right. Okay. And then I would want to just note underneath your tongue is sometimes where mouth cancer can be. So I would want to look for any signs of that, any ulcerations, or anything like that. Then I am going to ask you to stick out your tongue so that I can assess your uvula, and I'm going to use the tongue depressor, and I'm going to ask you to say ah. Okay. And what I was looking for there is to make sure that your uvula is symmetrical and moves up when you say ah, which it did. I would also be listening to the quality of your voice, if there's any hoarseness or any nasal like sound to it, like a nasally tone. When I had the tongue depressor in your mouth, I would have checked your gag reflexes for these purposes. I'm not going to do that. And that would be assessing cranial nerves 9 and 10. For every patient, you're not really going to probably do a full neuro assessment, but for purposes of this examination, we will. So I am going to, we've already assessed cranial number 1, which is your olfactory. That was your sense of smell. We did number 2, which is the optic nerve, when we were assessing your vision with the smell and eye chart. And then we are going to check your ocular movements, so your eye movements, which will be cranial nerves 3, 4, and 6. You do all them together. So this is where I'm going to ask you to look at my finger, and I'm going to ask you to follow my finger with your eyes only. So your ocular movements are intact, so that's wonderful. Next, I would move on to assessing cranial nerve number 5, which is the trigeminal nerve. I am going to first assess the sensation by asking you to close your eyes, and I'm going to ask you to tell me where you feel, I'm using a Q-tip, where you feel me touching.
Forehead. Right cheek. Chin. Left cheek. Nose.
Good. And then you can open your eyes, and then I'm going to assess I'm going to palpate the masseter muscles. So I'm going to ask you to clench your jaw, and I'm just going to be feeling to make sure that it's nice and strong, which it is. Next, I am going to move on to assessing your facial nerve. So I'm going to ask you to smile and frown and raise your eyebrows both, and then puff out your cheeks. And then that is just assess. I would want to just be making sure that everything moves equally, which it did. So that was cranial nerve 7. We have already tested your hearing, which is cranial nerve 8, the acoustic. We've done 9 and 10 when I was looking in your mouth, and then assessing the quality of your voice. And we didn't do the gag reflex, but that was part of it. And then next I would assess the accessory nerve, which is cranial nerve number 11. And I'm just going to ask you to shrug your shoulders, and I'm applying resistance. And then I'm going to ask you to turn your face towards my hand against resistance, and then same on this side. Good. And then for cranial nerve 12, the hypoglossal, I'm going to ask you to stick out your tongue and move it left and right. Very good. Okay. Following that, I would want to move on to assessment of your neck. So I would want to look at your, to make sure that your trachea was midline. I would want to palpate, make sure. And then I would want to palpate your thyroid. So I would feel for your cricoid process. And then I would ask you to swallow. And I would just feel, I would want to make sure that I didn't feel any nodules, make sure that you didn't have a goiter, one side bigger than the other, any of those things, any abnormalities. Then I would want to assess the range of motion of your neck. So I would ask you to touch your chin to your chest, and then go straight, and then go back, look at the sky, and then straight. And then you're going to turn your head to the right, and then straight, and then to the left. And then you're going to touch your ear to your shoulder, and then other side. Okay. So your range of motion in your neck is excellent. Next, I wouldn't want to forget to palpate all your lymph nodes. So I would start with preauricular, postauricular, tonsillar, submandibular, submental, occipital. Feel the cervical chain. And then along your clavicle. And I would just want to note any, if anything was like the consistency, if anything felt hard, movable. So I would want to make sure it felt good everywhere. Following that, next I would move on to assessing your back, chest, and thorax. So I'm actually going to ask you to take off your shirt. Okay, and I'm just going to ask you, since you're standing, if you can just turn to the side. So I would want to just assess your shoulders for symmetry, just checking the muscles of your back, and I could check for chest expansion, if you can just take in a breath. Good. And I would just want to make sure that your that it equally expands. And then I would palpate all the way down your spine, and I would ask you, is that causing you any discomfort, any pain anywhere when I'm doing that? Tenderness?
No.
No? Good. And then I'm going to have you turn around and face this way. I would inspect your chest, make sure that that is symmetrical as well. And then I would want to listen. I would want to auscultate your lungs, so I would get my stethoscope. I'm just going to ask you to breathe. And I'm going to ask you to turn. And I'm going to do this in a ladder pattern. I'm going to start here. Last one. Okay, you can go ahead and sit. And I would just be listening for any abnormal breath sounds like rales or rhonchi. Stridor, you do not have any of those. Your lungs sound clear without any adventitious breath sounds. So I would have been assessing the depth and rate of your breathing to make sure that there is no signs of respiratory distress, which there is not. Then I would want to move on to a more extensive assessment of your musculoskeletal, the upper part, the upper extremities, and just to check everything. So I would check. I would first want to check your hands. If you can put your hands out, I'm just gonna check the movement, and then I would be checking internal and external rotation. Okay. And then I would want to check your rapid finger movements. So if you can, very good. And then if you put your hands on your lap, and we're going to check the alternating movements. So you're going to go like this. Good. And then I want to assess your muscle bulk. So I'm going to ask you to put your arms like this. And then I'm going to ask you to pull me towards you. And then push me away. Good. And then I want you to squeeze my fingers. There we go. I knew you could do better than that. So just getting an overall assessment of your strength, which is 5 out of 5 in your upper extremities. It's equal. You have good muscle tone, no atrophy. So next I would inspect your breasts. It is important to, in either sex, to make sure that you do a breast exam. For a male, it's much more brief. I'm just going to assess size and symmetry of your breasts. I would inspect the nipple and areola for size and symmetry as well, and I would palpate the nipple palpate the breast and nipple for any nodules, abnormalities, and elasticity of your nipple. Then I would make sure that I was assessing the lymph nodes, the axillary lymph nodes. Okay. And then I would repeat that on the other side. And the same that I would be looking as I was palpating your lymph nodes in your head and neck, just assessing consistency, if there was anything hard or inflamed, redness, anything abnormal about that. Following that, I would move on to your cardiovascular assessment. So that's your heart. So now that I have you in the supine position at about 30 degrees-ish, based on the bed that we have here, I'm going to first start by palpating your carotid artery. So, and you would always want to do this one at a time. You would never want to occlude both carotids at the same time. And that is good. Then I could measure JVP by having a ruler. I would put that here at your sternal notch. I would put a card, and I would measure, and it would be, we'd want it to be around 3 centimeters. You want to make sure that you do not have an elevated JVP, you have no cardiac issues, and there's no concerns there. And then I would want to listen for bruits in your carotids using the bell of my stethoscope. So I'm going to ask you to turn your head. And if you can take a deep breath and blow it out and then hold your breath. Okay, you can go ahead and breathe. We're going to do it again. Deep breath and blow it out and hold your breath. Good. You can go ahead and breathe. I hear no bruits, so that's good. You definitely would not want to feel any of that. And then next, I would want to listen to your heart, and I'm going to listen in 6 positions. I'm going to start at the second intercostal space on the right side, and I'm going to move around. You could just breathe normal. And then I would want to listen for murmurs with the bell. All right, your heart sounds great. Normal S1, S2. I don't hear S3, S4, no gallops, clicks, rubs. So that's good. Next, I will move on to assessment of your abdomen. So I'm actually going to ask you to scoot down a little bit more. I'm sorry. And then I'm going to take this pillow out. And then I'm going to ask you to put your arms at your side, and if you could bend your knees up a little bit, not that much. There you go. I would want to first start with inspection, and like I said in the beginning, now that your upper half, you don't have your shirt on, I can view all of your skin. So I would do the same thing. I would observe the skin on your abdomen. I would just make sure that there was no, suspicious moles. You have a lot of, marks, but none of them are, a lot of nevi, but none of them suspicious that I can see. I would look to make sure that you didn't have any obvious pulsations, or I would note that your abdomen is flat, it's not rounded, it's not distended. So that's all part of inspection. Looking at that. And then next, I would move on to auscultation. So I'm going to listen in all 4 quadrants. I'm just checking to make sure your bowel sounds are normal. All right. Your bowel sounds are all normal. Then I would move on to percussion of your abdomen. I would make sure that I was using the proper technique. And I would percuss, and following percussion, I would then move on to light palpation first. So I'm going to palpate lightly in all the quadrants of your abdomen. Just feeling for any masses. And then next I'm going to palpate deeper. And then I could palpate your liver by putting my hands under here, and I would ask you to take, and I would see if I could palpate your liver border. I'm going to ask you to take in a deep breath and then blow it out. You do it one more time. Breathe in. Breathe in. And then breathe out. Okay. And then I could palpate for your spleen over here. Relax. Breathe in. And then breathe out. And I can't feel your spleen, which is a normal finding. Sometimes you can feel it. Other times you can't. I could feel just the edge of your liver border, which is a normal finding as well. So from here, I would not want to forget to assess the arteries in your abdomen. So if you could go ahead and put your hands at your side again, I'm going to listen with the bell. And I'm going to listen. The aorta. Renal. Iliac. And I would listen to femoral here and here. Next, I would want to make sure to palpate your femoral arteries. So I would feel there. Very good. And I would feel there. So following feeling your femoral pulses, I would also be examining your inguinal lymph nodes. I would then move on to feeling your popliteal pulse. Nope, you can relax your leg in your lower extremities. I would do that on each side. And then I would assess And then your dorsalis pedis on each side. And I would then remember that I had not assessed your radial pulses on each side. So I would want to make sure that those did not get missed. I would assess your brachial. There we go. All your pulses are normal, which is to be expected. So next, with the lower extremity assessment, I would want to just observe the skin, noting any, got a little scratch there, bruise here, but I would assess, your skin. I would be assessing for edema, and then I would want to assess range of motion. So I would start, for these purposes, you would do this on both sides. I would want to assess the range of motion of your lower extremities. So I'm going to bend your knee. So your knee bends, and then I would want to do external rotation of your hip, and then internal, and then just to make sure that your range of motion in your legs was good. I could have you push up against my hand and then push down. And like I said, we would do that on both sides with the hope that they were both symmetrical. Your strength is 5 out of 5 in this leg. I would anticipate it's the same in the other. So in continuing with the lower extremity examination, I would take a look at your feet. I would note that it looks like you have a little athlete's foot here. So, it's just a continual examination of the skin as you go through all the body parts. I would check capillary refill in all your toes. I would do it on both sides. And then I could also test for the Babinski reflex. So I could use the end of my reflex hammer, and what I would expect is that your toes will go in. So you'll just feel, okay. And then I would do that on this side as well. Couldn't really see that. An abnormal response would have been for your toes to flail like that, or open. I don't know if you call it flail. So next I am going to have to finish the musculoskeletal portion by asking you to stand. Now that you're standing, I am going to assess your spine. So I'm going to ask you to turn and then touch your toes. And then I'm just going to assess the alignment of your spine and make sure that it's no curvature there. That looks good. You can go ahead and stand up. And I'm going to ask you to turn. And I'm going to assess your the range of motion. So I'm going to ask you to lateral bend. And then twist. Good. Range of motion's intact. And then I am going to ask you to, take a few steps that way. So we're going to turn that a little bit. And then if you can take a few, yeah, that's good. You can take a few steps. Just walk. Yep. And I'm going to observe how you're walking. Okay. And then stop. And then turn around. And then if you could stop. And then if you could walk heel toe like that. Good. And you can turn around. And then if you can walk, stop. If you can walk on your heels. And then turn around, stop, and walk on your toes. Good. Okay. You can stop there. And I'm going to turn this back around. And then I'm going to have you hop on one foot. Good. And then the other one. And then just do a shallow knee bend, like a squat. Good. Ooh, lots of cracking. Okay. So next we're going to move on and check for pronator drift. So I'm going to ask you to close your eyes, put your arms in front of you like you're holding a pizza, all the way straight out. All right. You can go ahead and put your arms down. This was a quick version of it just to show how you would test, but you would actually wait a minimum of 30 seconds. The result of me pressing your arm down was normal. I would expect you to rebound from that. So that's a normal finding. So you can go ahead and sit down, and just a few more things left in our head to toe assessment. So I am going to assess the sensation. I am going to break this Q-tip in half so that this is going to feel sharp and that's dull. Okay? So I'm going to ask you to close your eyes, and you're just going to tell me if you feel sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Very good. Okay. So let me put this back up. You can open your eyes. Sorry. So following that, I would want to assess your active range of motion. So I'm going to ask you to push out against my hand. Good. And pull back. Bend your leg. Pull back. And then push out. And then pull back. And then push up. Push down like if you're driving a car. Yeah. Push, pull up, and push down. Okay. So it's just important to make sure that all your muscle bulk and tone is assessed as part of your full assessment. Next, I am going to assess your deep tendon reflexes, starting with your brachial. And I would do this on both sides. For these purposes, I'm going to do one side. I'm going to put my thumb there. I'm going to hit it with the pointy side of, there we go. Got it. All right. And then I'm just going to lower this a little bit so that I can assess your patellar reflex. Did that move? There we go. Got it. And then the Achilles. And I'm hitting it with the flat end. Like I said, I would do this on both sides. There's a real art to assessing the deep tendon reflexes that comes with a lot of practice. So I will be practicing that technique as needed. During our whole, this whole interaction, I've been just like assessing your demeanor, your affect, to see like, were you angry? Did you have a flat affect? Is there any concerns for just assessing your overall mental status? If you were an older patient and was concerned, I could do some cognitive tests. It is not necessary at this point. You're a young, healthy individual. You did tell me your name and date of birth. Can you tell me what year it is?
2024.
Very good. And can you tell me who the president is?
Joe Biden.
So you are alert and oriented to time, place. Oh, and where are you right now?
My house.
And location. So you are completely oriented. So no concerns there. So mental status is good. And then the last thing that we would do as part of physical examination would be a genital exam. For these purposes, we are not going to do that. So for the genital exam, I would start with inspection of your penis, your scrotum. I would check the color. I would check if you're circumcised versus uncircumcised. I would check for any abnormalities or deformities. I would then palpate. I would palpate your whole inguinal canal, and then I would palpate down. I would palpate the glands of your penis. I would palpate your testicles. I would feel to make sure there was no masses in your scrotum. I would make sure that your testes were descended. I would certainly hope at your age they are, and there's no problems there. I would also want to do a rectal examination and assess your prostate. And I would, inspect the area. You would be, since this exam is done, typically at the end, you always want to leave the most uncomfortable section of the examination for last. You would be laying down, you'd be on your side most likely for the rectal part, and I would inspect the area for any abnormalities. I would assess your sphincter tone, and then when I was doing the digital exam, I would assess for any masses or anything, and then assess your prostate. Once that was all completed, I would wash my hands. I would let you get dressed, and then I would review any concerning findings. I would ask if you had any questions or any concerns following the examination. Do you have any questions or concerns?
No.
And then I would thank you for your time, and that would be it.
Thank you.
Thank you.